Fibroid is a non-cancerous growth. Okay? There are non-cancerous growth, meaning fibroid not the cancer. Okay, and they usually affect women. And some persons has come out that they have a cure, a drug cure for fibroid. That they have this drug that they will give to you, and fibroid will be cured. My brothers and sisters, to the best of my knowledge as a doctor, that statement is a false statement, it's a lie. The highest drugs can do, either English drug or herbal drugs, the highest they can do, they will reduce the size of the fibroid. That is to say, they will shrink the fibroid. And over time, the fibroid can regenerate, can grow back. Okay? So that is what it does. So any person telling you to pay money, to send money to him, that he has a permanent cure for fibroid, and blah blah blah, please do not respond, do not answer those guys. Okay? And fibroid can actually be symptomatic or asymptomatic. There are fibroids that doesn't disturb person. Then those ones you don't even to bother yourself about. And let it be known that despite the fact that it is documented that fibroid can cause infertility. However, many people can become pregnant in the presence of fibroid. They can even put to birth in the presence of fibroid. So having a fibroid does not amount to having a problem that will impede your ability to get pregnant, or it will automatically start affecting your menstruation. No, there are some fibroids that are asymptomatic. Then let's go back to the treatment of fibroid. We have two modalities of treatment for fibroid. There are drugs, either English or herbal, okay, that has capacity to shrink, to reduce the fibroid, so that those symptomatic fibroid, those symptoms can reduce. Okay? And why? The definitive, the permanent, the guarantee cure for fibroid is either myomectomy or hysterectomy. Myomectomy means an operation that is done in the womb to remove the fibroid, if it is single or one or two multiple fibroids. Okay? And hysterectomy is the total removal. Okay? These are the two options that will give you a permanent cure for fibroid. Other options is employed because one, maybe the person still want to have children, so there is no need of doing hysterectomy. So they will do what we call conservative management. So long story short, fibroid exists and it presents as uterine tumor. Two, it can make your abdomen to be enlarged. People will be thinking that we are pregnant. Three, it has two modalities of treatment. One is a permanent cure, which is done by only surgery, only operation. And the other one is palliative, conservative, meaning to reduce the size so that the disturbances or the symptoms that are associated with fibroid can be reduced. Ours does not give a permanent cure to fibroid. Rather, it shrinks the fibroid, makes it to reduce, and other drugs are supportive, which can reduce the pain that's associated with fibroid and the bleeding that's associated with fibroid. Thank you very much.